So let's have a look at anatomical planes to start off with. Now, there are three anatomical planes in the body, and really they divide the body into sections and they help us analyze the movement that we're doing. So we've got these three, and they're called sagittal, frontal, and transverse. And really, what they're doing is they're dividing the body up into specific sections and allow us to move through specific joint actions. So, sagittal, for example, is all about moving forwards and backwards in space. So, if you look at the image above here, you can see that the very top image has a line drawn right down through the center of this man. And as he's standing there, if he was now to move his arms up in front and then put them back down, he's literally moving in the sagittal plane. Or if he was to walk forwards, he's moving along that central division and back again. And really, you can really see that well from the side. So that's sagittal movements. Frontal plane movements are those that happen along the plane drawn in the second image. So this is where it cuts across your shoulders. It literally cuts you in half front to back, so anterior to posterior. And this means things like raising your arms up to the side or kicking a leg out directly to the side is all a frontal based movement. Then you have transverse movements, which is relating to the bottom image here, and you have this division between upper and lower body whereby you're really moving in a twisting pattern, and this is moving along that axis. So having a look at all three of these anatomical planes in detail. So a nice easy ways to remember them, and I'm going to give you some examples and some joint actions that happen. Now, this is really key because if you can remember that in sagittal plane, only flexion and extension occurs, then you know how to start breaking down all of the exercises that happen. So, for example, sagittal plane is just flexion and extension, which means that things like bicep curl, whereby you're just flexing in the elbow, must be in the sagittal plane. So it's moving through the sagittal plane. Now, the easy way to remember this is that if you look at that movement from the side, then you can see it in its you see the greatest angle movement. Now, S equals sagittal, S for side, see it from the side. Now, this includes things like walking, it includes things like squatting and lunging. But the best way to remember it is that flexion and extension is always sagittal. Then we have frontal plane movements. Now, these are things like shoulder pressing, things like a side lunge, so like a lateral lunge, or hip abduction, whereby you're standing on both feet and you just lift one leg straight out to the side. Now, these movements are all happening on this frontal plane, which means if you wanted to see the greatest degree of movement change, you would view it from the front or the back. So if you think of someone doing a shoulder press, if you really want to see their form and see how they're moving, you would always look at them from the front, and that makes it a frontal movement. But really the thing to remember here is it's abduction, which remember is moving away from the midline, and that includes with the arms. You can abduct, so that's like a shoulder press does. You abduct the arm from away from the ribs, or it's with your hips, whereby you're lifting a leg out to the side. You can also adduct, which is the opposite of that. So that's things like a lat pull down would adduct your shoulders back down towards your ribs. Then you've got lateral flexion and extension. Now, lateral flexion usually refers entirely to the spine itself. So if you stand nice and tall now and just take one ear to the same shoulder, so take your right ear and put it towards your right shoulder, that's what we call lateral flexion, and you're doing it in your cervical spine, which is the top portion of your spine. So lateral flexion is this bending side to side. And obviously extension is the version where you're coming back up to center. And then we also have elevation and depression. And this is basically shrugging your shoulders. So elevation is to lift the shoulder blades, depression is to push them down. So we end up with abduction, adduction, lateral flexion and extension, elevation and depression, all corresponding in the frontal plane. And if you can do those movements now and relate them to your frontal plane, then you'll be set up perfectly for it. Now have a look at transverse. Transverse is partly all about rotation and also about things that happen in a scooping motion in front of you or behind you. So take, for example, a pectoral fly motion, whereby your hands are in front and you take them to the side and then you bring them back in front of you again. Now, this is happening in a space that is neither frontal nor sagittal, because really it's happening across that whole plane, whereby it's moving evenly in its horizontal space but around you. And similarly, if we then twist side to side with our spine, it's a similar motion in space. We're making the same sort of movement through the space around us. Now, you would really be able to see that movement and the greatest degree of movement from the top. So you'd really be able to see the greatest movement from the top, which is why it's transverse. Nice, easy way of remembering it. T for transverse, T for top. Now, spinal rotations, pec fly and rear fly are all perfect ones for transverse plane. Now, this includes rotation, pronation. So pronation, if you put your hands face down on the table in front of you now, that's pronation. So your hand palms are face down. Supination is the reverse of that, whereby your hands are up like they're holding a bowl of soup. So supination. Now, these other two are also part of transverse, and that is with your shoulder blades, and that's retraction back and then protraction forwards. So retraction back of your shoulder blades is like you're squeezing a nut in between your shoulder blades. You're trying to squeeze them back as far as possible. Protraction is the reverse of that, whereby you're opening your shoulder blades up the most that you possibly can by almost curling your shoulders forward. Now, these two, retraction and protraction, relate to the pec fly and rear fly. And the reason why people get confused with that usually is because they don't see that their shoulder blades are moving enough in that exercise. And that's what we're looking for, the shoulder blades to move and really get that movement across in a transverse plane. The next one is inversion and eversion, and this is the movement of your foot. So inversion is this turning inwards motion, and eversion is turning out of the foot or of the hip. Then you've got horizontal flexion and extension. And horizontal flexion is the same as when we had a pec fly a moment ago. These two relate together. Horizontal extension is right in close. Your hands are touching each other right in front of you. And then horizontal, horizontal flexion is where your hands are together in front of you, so straight out in front. And then horizontal extension is when you raise those arms and you stretch them out to the side so that they're either side, like you're standing in a T shape. So horizontal flexion is closing the gap in front of you. Horizontal extension is bringing them out to the side, just like a pec fly or rear fly motion. Now, some exercises you do will have more than one plane within it. So, for example, you might be doing a bench press and you're working primarily in the transverse plane because you're working with your protraction and retraction of your shoulder blades, but you've also got a bit of extension in your elbow, which means you end up with a combination of planes. Or you might do a squat with your legs, but a twist or a reach with your arms, or a squat shoulder press. So you can combine exercises and movements in different planes. And it's really, really important that you think about developing exercise programs that allow for people to be tri-planner. i.e. use all of the planes that are available to them. So most people will stay in sagittal because they sit down all day, they just walk, they're only moving in a forward and backwards motion. So it's important to include frontal and transverse planes as well. Now, a little task for you here is to go through the motions that I've got written here on the right. So pause the video. You're going to go through walking, squatting and lunging and relating that and really thinking about what joints are extending and flexing. Don't think about the muscles, think about the joints. What ones are extending, what ones are flexing, and how that is in a sagittal plane. Then look into shoulder press, side lunge and abduction, hip abduction, and see how that's frontal. And then play with spinal rotation, pec fly and rear fly, and really see how that is transverse. And these planes of motion people often get confused with because they haven't put it into their own bodies. So pause the video now, and once you've paused the video, you'll be able to just go through, try these 9 exercises or more if you want, to work out the actual planes of movement that you have in your body.